Catheter care is a very personal experience and needs to be done in a sensitive and respectful way. In this video, we will show you how to take care of a catheter so that you will feel a little more prepared. Caring for someone with a catheter is a delicate task that requires both knowledge and compassion. We approach this task with respect, care, and attention. First, we will show you how to empty the bag. Second, how to clean around the catheter tube. Third, we will explain how to change a catheter bag. And fourth, we will explain how to clean the bags if a replacement bag is not available to you. Number 1, empty the bag. To do this, you'll need a container to empty the bag into, an alcohol swab, and gloves. It's also a good idea to have a waterproof pad or towel to put under the container in case of splashes. Open the clamp at the bottom of the bag over a container. Let the urine drain out of the bag until it's empty and reseal the clamp. Finish up by cleaning off the clamp with an alcohol swab. That's it. Number 2, cleaning the catheter tube. 2 main types of catheters stay in at all times, even at home. Indwelling catheters are the type most people think about. The tube goes through the urethra so the urine can drain into a bag. Suprapubic catheters stay in at all times and have a bag, but the tube is placed in the lower abdomen with surgery. For both types of catheters, the supplies you'll use in the process of cleaning are very similar. You'll need disposable gloves, soapy and clean water, washcloths and towels, gauze, and a waterproof pad. Cleaning around the catheter is often the most uncomfortable part for both of you, but doing this daily helps prevent infection and trips to the hospital. First, empty the bag so it doesn't pull on the tube while you work. Start by asking the person if you have consent to wash the private areas. While holding the catheter tube as close to the body so it doesn't pull, use a clean, warm, soapy cloth, gently wipe down the tubing away from the person's body. You can repeat this as often as needed if there's any buildup on the tubing. When a suprapubic catheter is first put in, it may need to be cared for by a nurse. But once the surgery site is healed, it is safe for you to care for it. You can wash around the tube with soap and water, starting at the tube and cleaning outwards in a circular motion. Once both types are washed, rinse well with clean water and pat dry. Sometimes people like to have a piece of gauze placed around the suprapubic tubing like this to make it more comfortable. Number 3, changing the bag. The person you are caring for may use different kinds of bags you may need to change. Using a bigger bag at night can be helpful, but if they're able to walk, a smaller bag that attaches to their leg may be easier to manage during the day. To change the bag, you'll need a clean drainage bag, gloves, alcohol wipes, a container to drain the urine into, and a waterproof pad or towel. Let's try it. After emptying the bag, place a towel, cloth, or waterproof pad under the connection between the catheter tubing and the bag tubing. Have your new bag nearby, then pinch the catheter tubing and carefully disconnect the catheter from the old bag. Wipe the catheter tubing with an alcohol wipe and connect the new bag. Discard the old bag. If a replacement bag is not available, set the old bag aside and clean it afterwards. There are a few ways to hold the tubing in place. Belts, clamps, and anchors are some of the most popular ways. Whichever the persons you are caring for uses, make sure the tubing isn't bent or kinked and that the urine is flowing into a bag after you change it. Be sure the position of the catheter is below the level of the person's bladder to allow for proper drainage. Number 4, cleaning the bag. This should only be done if a replacement bag is not available. You'll need gloves, soap, water, white vinegar to clean the catheter bag. A funnel will also be helpful. Using a funnel, fill the bag with warm soapy water. Swish it around, then let it drain. To reduce odor and kill bacteria, rinse the bag with vinegar and water. It's best to use a 3-to-1 ratio. So 1 cup of vinegar is used to 3 cups of water. Use the vinegar solution to rinse out the inside of the bag and let it drain. Hang the bag where it could drain and dry. You should wash the bags daily and use a new one once every week. Proper cleaning is important because it helps prevent infection and visits to the hospital. Catheters can be intimidating at first, but they do not have to be. Reach out to your local home and community care program or health center for assistance if needed. For more caregiver support and resources, be sure to visit our care channel.